Welcome to our exploration of pulp and periapical diseases, crucial topics in dental health. The pulp occupies the central portion of the tooth and is vital in forming primary, secondary, and reparative dentin throughout different stages of tooth development. The pulp organ is divided into two main parts, the coronal and the radicular, each playing a distinct role in dental health. Pulpitis is the inflammation of the pulp, primarily characterized by pain, and is a common dental issue. Common signs and symptoms of pulpitis include pain when biting or chewing, facial swelling, tooth discoloration, and sensitivity to temperature. Diagnosis of pulpitis involves clinical findings, radiographs, and pulp vitality tests to accurately assess the condition. Diagnostic tests such as percussion, palpation, radiographs, and thermal and electrical tests help in identifying pulpitis. Pulpitis can be caused by bacterial factors like periodontal pockets and caries, or traumatic factors such as crown fractures and bruxism. Iatrogenic factors, including heat generation and pulp exposure during dental procedures, can also lead to pulpitis. Pulpitis is classified into reversible and irreversible types, each with distinct clinical features and treatment approaches. Reversible pulpitis is marked by sharp, intense pain that responds to thermal changes and can recover once the stimulus is removed. Treatment for reversible pulpitis focuses on protecting the pulp from thermal exposure and using sedative dressings in carious teeth. Irreversible pulpitis involves persistent pain and inflammation that does not subside without treatment, often requiring more intensive intervention. Treatment options for irreversible pulpitis include root canal therapy or tooth extraction to alleviate the condition. Reversible pulpitis is characterized by sharp pain and short duration, while irreversible pulpitis involves dull pain and longer-lasting symptoms. Root canal therapy is a common treatment for pulpitis, involving the removal of infected pulp and sealing of the tooth. Acute pulpitis can be focal, affecting one horn of the pulp, or total, involving the entire pulp, often due to overheating during dental procedures. Acute pulpitis resembles an abscess, with necrotic tissue and inflammatory cells, leading to a pulpal abscess. Toxins from pathogens destroy the pulp, and the exudate spreads to the periapical area, potentially affecting surrounding bone. Chronic pulpitis is a low-grade irritation often seen in older teeth with restorations, leading to dentinal tubule sclerosis and reparative dentine formation. Pulpal fibrosis is a condition where loose fibrocollagenous connective tissue shows diffuse infiltration of lymphocytes and plasma cells throughout the pulp. This can lead to the formation of pulp stones and dystrophic calcifications, which may be present in both coronal and root pulpal tissues. Prolonged chronic pulpitis can lead to pulpal necrosis and is often associated with asymptomatic periapical lesions. When a fibrous nodule forms with lymphocyte and plasma cell infiltration, it is termed a periapical granuloma. Chronic hyperplastic pulpitis is a productive inflammation of the dental pulp, often seen in young children with large pulp chambers. It results from rampant caries and can lead to excessive blood supply and open apical foramina. The regenerative capacity of the tissue, along with increased blood supply, can lead to a hyperplastic pulp or pulp polyp. This condition is asymptomatic and may appear red if ulcerated or infected. Let's explore the various diseases affecting periapical tissues, which are crucial in understanding dental health and pathology. Periapical periodontitis involves the spread of infection to the apical periodontal ligament region, often resulting from untreated dental caries. This condition can be acute or chronic, presenting with mild pain during chewing and percussion. The tooth may appear slightly elevated due to inflammation. Radiographically, periapical periodontitis shows a loss of lamina dura and widened periodontal space. Endodontic treatment is often required to address the infection. A periapical granuloma is a localized mass of granulation tissue formed at the apex of a tooth, often resulting from chronic infection. Typically asymptomatic, a periapical granuloma may present with mild pain during chewing and cause the tooth to be elevated from its socket. Radiographically, a periapical granuloma appears as a radiolucent area attached to the tooth apex. Treatment may involve extraction or apicectomy. A periapical abscess is an acute or chronic suppurative process in the periapical region, often associated with a discolored tooth and sinus tract openings. This condition may present with regional lymphadenitis, fever, and sinus tract openings, especially in its chronic form. Radiographically, a periapical abscess shows ill-defined radiolucency. Treatment involves drainage of pus and sometimes endodontic procedures. A periapical cyst is chronic and asymptomatic, often associated with a vital tooth. It can cause massive swelling and bone destruction, leading to an eggshell cracking sound. Radiographically, a periapical cyst is well circumscribed with a sclerotic border. Treatment may involve extraction or marsupialization. A dentoalveolar abscess is an acute infection beyond the alveolar bone, involving neighboring soft tissues and causing extreme pain and swelling. This condition is characterized by continuous, throbbing pain, localized swelling, trismus, lymphadenitis, and pyrexia. The progression of pulpitis can lead to various conditions, including acute and chronic periapical abscesses, dentoalveolar abscess, and radicular cysts. Infections occur when the balance between host, organism, and environment is disrupted, leading to disease. This understanding is crucial in managing dental health. Odontogenic infections can be categorized into acute and chronic stages, each with distinct manifestations such as abscesses, cellulitis, and chronic osteomyelitis. Cellulitis is a diffuse infection of connective tissue, often affecting the face or lower legs, and can be caused by bacteria entering through broken skin. Cellulitis can be triggered by bacteria like Streptococcus and Staphylococcus, minor skin injuries, or conditions like diabetes and impaired circulation. Risk factors for cellulitis include diabetes and immunosuppressive conditions, with symptoms like painful swelling, inflamed skin, and elevated temperature. Cellulitis involves lymphocyte exudation and muscle separation, treated with antibiotics and sometimes surgery to remove infection stimuli. Cellulitis and abscesses differ in duration, pain, size, and bacterial presence, with cellulitis being acute and diffuse, while abscesses are chronic and localized. Ludwig's angina is a severe cellulitis affecting the mouth's floor, often linked to dental infections, and can be life-threatening if untreated. Causes include injuries and dental infections, with symptoms like mouth floor swelling and difficulty swallowing, requiring prompt medical attention. Ludwig's angina can cause breathing difficulties and neck swelling, treated with antibiotics and possibly a tracheostomy for severe cases. Cavernous sinus thrombosis is a serious complication of facial infections, often involving bacteria like Staphylococcus, and can lead to high morbidity. Staphylococcus aureus is a common cause of these infections, affecting all ages, with a mean age of 22 years for cavernous sinus thrombosis cases. Symptoms include headaches and orbital pain, with potential for severe complications like periorbital edema and visual disturbances. Without treatment, symptoms can spread to both eyes, leading to confusion and coma, highlighting the need for urgent medical intervention. Treatment involves antibiotics, anticoagulants, corticosteroids, and sometimes surgery to manage the infection and prevent further complications. Dental infections can spread through facial planes, originating from caries and potentially leading to serious conditions like cellulitis or osteomyelitis. Infections may track through the root apex into deeper tissues, causing significant oral and facial complications if not addressed promptly. Superficial infections cause localized pain, while deeper infections can lead to fever and difficulty in swallowing or breathing. Infections can spread to various tissue spaces, including buccal, parotid, and submandibular spaces, affecting the floor of the mouth. A diagram illustrates how infections can spread through buccal and palatal spaces, emphasizing the complexity of dental infections. Different dental spaces can become infected, each with specific clinical presentations, highlighting the need for targeted treatment. Pathogens can move between facial spaces, leading to conditions like cellulitis or Ludwig's angina, necessitating careful management. Periapical infections can progress from pulpitis to conditions like osteomyelitis, illustrating the interconnected nature of dental pathologies.